Good morning. Welcome everyone to our weekly media briefing, one day early. This is the media briefing for the COVID-19 incident in Shasta County. I'm Carrie Schutte. I'm the Public Information Officer for the Shasta County Health and Human Services Agency. We'll start like we always do with the numbers. As of now, we have 2,630 total confirmed cases, including 141 from Friday and 37 from Saturday. We've done a total of 71,759 tests. We've got 17 people hospitalized, 2 of whom are in the intensive care unit. We've got 105 people in isolation, another 361 on quarantine, and we have had 34 deaths. As is customary on Tuesdays, we have learned that we are even more purple this week than we were last week, if that is possible. We are up to a 20.2 per 100,000 case rate, which is up from 10.4. So that's a big, huge jump. Our unadjusted case rate is 24.9. So our testing volume did pull that number down, but still really, really way too high. We've got a positivity rate of 6.1%, which is up from 4.1%. I also wanted to make you all aware of we are starting to post some information about holiday gatherings on our website on shastaready.org. Toward the top, you'll see a link to some holiday gathering information. We're still working on additional information for that, but it should give you all a good start with figuring out how to plan those holiday activities a little bit more safely, including weighing the risks of gathering against the potential benefits, how to maximize your safety and minimize the risk to yourself and to others. We've got a variety of guidance on there about that. And of course, we want to make sure that people do continue to stay home if they have a known exposure, if they have symptoms, if they've been diagnosed with COVID and isolated, or if they have a household member who is at increased risk of severe illness. So hopefully that information is helpful to those who are planning ahead for those holiday celebrations in the next month or two. Things will look different this year, but can still be celebrated in fun and healthy ways. With us today, we have Dr. Karen Ramstrom is our Shasta County Health Officer. Donnell Ewart is the Director of the Shasta County Health and Human Services Agency. Matt Pontus is our Shasta County CEO. And then from our local healthcare partners include Robert Folden from Mercy Medical Center Redding, Dean Germano from Shasta Community Health Center, and Mark Mitchelson from Shasta Regional Medical Center. Do any of you have anything that you would like to start us out with before we open to media questions?
I do, everybody. I want to just provide some cautions today. Our case rates are very high right now. Across the county, across the community, in a variety of different settings. And so I would caution people, especially if you're medically vulnerable or you are among our older population, or if you have any of those types of people in your household or in your workspace, it's really important to be really careful right now and avoid being around other people outside of your household. Avoiding close contact, masking whenever you are out of your own personal isolated space, and taking those precautions very seriously right now. We are seeing cases in the same sort of settings we have all along. Household contacts are a very high risk, as well as if you're getting together in social gatherings, whether that's with your family or it's with friends. We've already seen some cases associated with Halloween parties. We expect to see more. This is not a good place to be going into the holidays. Our hope was to actually enter the holiday season with low case rates so that we would be able to take advantage of that and celebrate safely with our family members. I think that's going to be very challenging this year, and we're all going to have to take extra care. And I think the other reminder that we've continued to share is that we want to make sure that our places of business, whether it's retail or other types of workspaces, are safe for workers and for the public when they enter those spaces. And so as well as keeping our schools open to in-person instruction. So those are the kinds of things that we risk when we have behaviors that contribute to the spread of this virus. And so just some extra caution right now. These are all personal choices that we make, and we hope that people take that very seriously. For now, we are having very high case numbers, and so please, if you actually hear from a lab or your doctor that you are confirmed, we ask that you self-isolate. There are instructions on what that looks like at shastaready.org under the isolation quarantine button at the very, very top. There's also some videos there that explain what that means. It may be delayed in terms of public health reaching out to you. And so we want you to take those precautions while you're waiting to hear from us. The other thing I would just say is that we've heard reference to COVID parties. This is not chickenpox, this illness, and that is very much discouraged. This is a disease that we don't know the long-term impacts. We know that people are ending up in the hospital, even young people. This week, Butte County announced a death of another young person who had no underlying health conditions. And so we want people to take this seriously, and we do not want our community members to contract this virus. And so that's all I have this morning. So please, everyone, take care, and I'm happy to take questions.
All right, thank you, Dr. Ramstrom. Anybody else have anything to start us out with?
Yeah, I think we just wanted to remind the community to make sure to go to shastaready.org to find the testing sites nearest you. Do not come to the ER if you are asymptomatic and just want to test. I'm not sure if it's just the increase in numbers within the county or if it's the weather change, but we have seen a fair amount of people try to come to the ER to be tested when they're asymptomatic, and that's not the appropriate venue. Make sure to go to the website, find the best location for you, and sign up online.
Thank you for that really important reminder, Mark.
Dr. Ramstrom or Donnell, I thought I read there's going to be another testing site for people coming up soon, other than the college.
Yes, thanks, Dean. So we expect to hear sometime this week. We submitted our wish list for state testing resources. We submitted that last week, and expect to hear any day now. And those assets will start next week. We asked for another testing site similar to Shasta College that we would position in a different geographic area, and we have a couple ideas about where that might be. That's still in the works, but we're hopeful that we will get that additional testing site that you can go online and sign up to go to. In addition, we have requested a traveling team that we would have on a regular schedule in different parts of the county regionally to be able to do screening, surveillance kind of testing, or if people have symptoms or they're a close contact, they could go to those locations. We also will be getting more information out about an additional state resource that I think is going to be very, very helpful to employers to do regular screening, surveillance testing of their employees. The individual businesses or other types of entities, churches, what have you, can go online and submit your testing plan and receive these kits in the mail. And it's just self-collection, and you mail them back, and they get run at the PerkinElmer lab with 1 or 2 day turnaround. So those are 3 testing resources that we have requested, and we're hopeful, being deep in the purple, that we are likely to receive those, and that would be standing up sometime next week. So that's our hope. It can't come fast enough, as you mentioned, Mark. It's unfortunate, I think our testing options are maxed out right now based on people who are symptomatic or their close contacts wanting to get tested. So we're happy to know those state resources are on the way.
All right, any other items to start us out with?
I'm sorry, yes, the sound fluctuated a little bit at one point. Can you repeat the case rate this week? Could you repeat the numbers that you said at the beginning, Carrie? Sorry about that.
Sure, we'll be sharing that on our, in our daily update today, but our case rate is 20.2 and our positivity rate is 6.1.
I actually
And
got that, but I missed what it was last week. Did you say it was 4%? The positivity
week-
rate last week?
Yes, it was 4.1.
Thank you. Sorry about
Yeah, and I just wanted to add that the 20.2 is our adjusted case rate. That's adjusted for testing volume because we're having a high amount of testing volume. Unadjusted, it's 24.2. So very high.
Robert, you turned green a couple times.
Okay,
Did
to
you
check.
have something you?
Yeah, so I just wanted to, I guess, comment on, as we've seen the increase in activity within the community, obviously that's going to translate over to the acute care settings as well. So all along, I think we have talked about how the 3 hospitals here in the county work together as we do our reporting and our planning and our surge activity. So, you know, today, I think as the numbers come out, we'll see that we've seen a pretty significant increase just over the weekend. So when I left the hospital Friday afternoon, you know, we had roughly 13, 14 patients that we were caring for. And today, that's a very different number. It's almost doubled. So, you know, as we continue to see the volume go up within the community, it only stands to reason that there may be a larger group of folks that need to seek care. And that's why we're here. That's why we've planned for many years, quite frankly, and it's why we've spent a significant amount of time with the county, with the other 2 hospitals, preparing kind of for this moment. So the good news, you know, we have lots of capability here in our hospitals. Our staffing is good. We're certainly looking for some additional staff as we go into the winter months, because inevitably someone may get the flu or may need to have surgery or whatnot. Folks love to take time off. We all love to take time off during the holidays. So we continue to look for additional staff to help backfill. Our PPE supply is in good order. And again, as we've all heard, as raw materials become available, we're starting to look at what other alternatives are out there, or what other alternatives are out there should we experience a hiccup in our supply chain. So again, from a community standpoint, there's an uptick. We have more patients in the hospital today than we did last week. We're weathering this quite well, and I'm grateful again for the partners that are on this call for the planning that we've done, because had we not done that, had we not invested that time, we wouldn't be ready for this today.
All right. Thanks, Robert.
Gary, I just wanted to follow up on some of Dr. Ramstrom's comments and just say that right now we're seeing the highest number of cases in Shasta County than we've seen during the whole pandemic, and the highest number of hospitalizations. So now is the time for us all to come together as a community and act together so that we can conquer this virus. And it's going to take everyone's participation. So we need all the institutions of government to modify their programming and the way their offices function, their business practices. We need the businesses to do the same, and we need individuals also to change their behavior. We all need to work together. We need to create a culture of care and concern for vulnerable residents who really can become very ill with this COVID-19. And when any part of the community doesn't comply with kind of the tier we're on, which is purple, then it sends a message to other community members that they don't need to comply. So it's really essential that we all do our part, that we all see what we can do in our sphere of influence to modify our practices, to stay home, stay away from others, not gather, so that we can reduce risk. We can stamp this thing out, because it's going to take more than just our containment efforts. It's going to take these community mitigation efforts. We need everyone's participation.
All right, anyone else have anything to add before we open to media questions? Okay, I think that's all of us. We are ready for any media questions that you might have.
Well, Donnell, first, your shirt color is appropriate for this time right now. I wanted to ask, are federal workers, federal facilities not bound by the state recommendations? Like, I've been told that like federal workers, they don't necessarily have to wear masks. I mean, it's their choice, but the federal government is not bound by state regulations. True or false?
I would think that that would be false because you'd be working in a business or a facility that's in the state of California. And so I'm not sure what setting you're talking about, Mike. And I haven't heard this come up. But my understanding is it's the facilities in California where those requirements are being implemented. So if you have a specific, you can either share now or shoot it to me later, and I can look into that.
Okay, yeah, I don't want to rat anybody out. But yeah, I was in a federal place, and that's what I was told why some of the workers there were not wearing masks.
You know, Mike, our polite society revolves around social contracts, and quite frankly, a mask is the simplest thing every one of us can do to say, I care about you. I'm going to prevent transmission from me to you. It's kind of common decency what we're talking about right now. And I'll stop there.
You are right.
I appreciate Robert's response. And I just want to add that this is not a time to be looking for how we can get around the rules. This is a time for us all to be asking, how can we go beyond the rules? How can I do more, not less than what's required?
What can we do more? I'm trying not to get depressed here because, as Dr. Ramstrom, said very succinctly, that we have a lot of cases now and we're not even to the holidays yet. So help us all out here. What can we do beyond the masking, the washing of hands, the social distancing? What else as a community can we do to try to turn this around?
I think some of the things that Donnell shared, various sectors, places of business, making sure that you're implementing fully those modifications to keep people who come to those spaces safe. I would say similar to with the original stay-at-home order back in the spring, we suggest people stay close to home right now. And so going to work and making sure that you're having safe practices in your workspace. When that's if it's appropriate to be in your workspace right now, and then only going home and limiting your contact really to your household members or whoever is in your small social sphere where you have agreed to be safe together. And now is the time to just sort of think about other types of activities that do not involve getting together in large groups with people that you don't normally congregate with. It's just not a good idea right now. It's just not a good idea. And don't think that you can do that safely because we've seen example after an example of it spread. And so that would be my main recommendation. Just stay close to home right now.
Are we kind of maxed out with are we kind of maxed out with testing right now? Is that kind of what I heard? We're waiting to get more testing, but right now, because of the increase in cases, the testing sites are pretty crowded.
Yeah, that's our understanding. That's what we're hearing from a variety of partners and individuals who are trying to access testing, because just so many people have symptoms, or they know that they're a close contact and they want to get tested. Now might be the time for us to let the people who have symptoms go and get tested. And if you have been a close contact, stay home for now. And in a couple of weeks, we'll have more access. But right now, we would encourage those individuals who are close contacts maybe to defer testing and let people who are symptomatic get tested at the community testing locations.
I'd just like to add that there was an article, and I know facts seem to mean different things to different people these days, but the journal, I think it's Nature Medicine, did a modeling of what would happen with 95% masking across the United States in terms of the number of deaths based on scientific modeling. And they estimated between the end of September and the end of February, if there was 95% of universal masking, it would save about 129,000 lives in the United States because of COVID. So even if that was 50% true or 75% true, there's some real, masking does make a difference. And what we're doing, at least from my assessment, is we're buying time so that the immunizations can come online that can get us through this. And that's it. It's not the answer in and of itself. It's buying us time till we can get there to do the other things that are necessary. So anyways, so.
All right, other questions?
Hi, good morning, everyone. It's Anna from Channel 12 Action News Now. I just wanted to follow up on something. Dr. Ramstrom, you mentioned COVID parties. Can you be a little more specific? Are you talking about like people who are getting together when they shouldn't? Like, what do you mean by COVID parties?
Yeah, I haven't been invited yet, so I'm not exactly sure, but I think it's people who have been confirmed and they say, hey, you know, friends, come on over and let's everybody get exposed because then we'll have community immunity. Well, that's just not the case. Then you actually will have COVID. That's what will happen, and that's not good. So that's my understanding about what a COVID party is. There's this misconception that, you know, if we expose everybody, then we're going to get to community immunity. But you know what that's going to do is going to result in huge number of hospitalizations and deaths. And so as Dean said, we're just buying time, you know, by masking, staying away from each other, trying to prevent infection. And that's how we're going to get to the immunity level to prevent spread in our community is with vaccine over time. And so COVID parties not recommended.
Just to be clear, these COVID parties are, from what you're understanding, is that they're people who may most likely have COVID, and they're inviting people to come over to claim that they can create some form of herd immunity. Is that what it is?
That's what I've heard. Again, nobody's spoken with me directly about it, but that's my understanding.
Thank you. And then I also wanted to follow up for anyone on this call. You know, you mentioned we're seeing higher cases, and if we're falling further and further deeper into the purple now, with those Halloween cases that came out, is our positivity rate and case rate attributed to those latest Halloween parties and gatherings?
I would say at least in part, you know, it's all related, right? So there's more transmission in the community. And so anybody having a Halloween party is more likely to have someone show up who has it, who could spread it there. And so we have it in a variety of spaces, whether it's a Halloween party or other types of social gatherings. And that's where it can transmit to other individuals because you have closer contact and you might, be having refreshments and taking your mask off that you're otherwise wearing, hopefully. And then it spreads. It spreads when you're eating and drinking and celebrating and having close interaction with people. But we do think some of it is related to those kinds of Halloween parties, but that's not the only type of social gathering that we've heard about.
And are these Halloween gathering cases, are they also tied to our recent fallback in the purple tier?
So I think all along we've seen that social gatherings contribute to increase in cases, which has contributed to our purple tier.
All right, other questions?
Oh, sorry, Anna here. I don't know
Yep.
if you guys heard me there. I just wanted to know, do we know how many of these cases are connected to these parties?
Well, we're probably going to continue to see additional cases. Not everybody always tells us exactly everywhere that they've been, but we do have some specific examples that is the case. The other thing is that I know, not everybody has symptoms, so they might not even get tested, and not everybody that has symptoms gets tested. And so there's probably even unidentified cases that are associated. And so I don't think that we're going to be able to, have a comprehensive analysis of how the Halloween parties have contributed to our cases. We're probably going to be here and there, but that's not surprising because we know social gatherings are a place that transmission happens.
And so was it surprising? So like you mentioned, it wasn't that surprising to see when we saw these Halloween parties, like have expected growth in our COVID cases because people were getting together.
I would say that anytime there's a holiday where there are a lot of people that are inclined to get together and celebrate, that we would anticipate an increase in cases, yes.
And you mentioned holiday. I mean, we have Thanksgiving coming up. From public health standpoint and any of the hospital partner standpoint is, a lot of people are really urging or feeling that they want to be together with families right now. Does anyone see like a projection in seeing more cases bounce up like we've seen in this Halloween get together?
So that's why we have tried to be proactive and create some guidance for how people can celebrate the holidays a little bit more safely. You can go to shastaready.org and check out some of those documents. It absolutely is possible to continue to have safe, fun celebrations of the holidays. They just need to look a little bit different this year than they have in the past.
Perfect. Oh, sorry. I just wanted to follow up on one more thing about the up and running testing site. For anyone in public health, just wanted to clarify, I'm not sure if I missed it, but when can we expect these resources to go up and running here in the county soon?
So we're supposed to hear this week what types of resources we are going to receive, and our understanding is that they will start to be rolled out next week.
Perfect. And to be clear, there's like 3, correct? There's the testing site, a new testing site, a mobile testing capability, and then testing for employers to give to their employees, correct?
That's correct.
All right, any other questions? All right, anything else for any of our panelists that they would like to add?
I did want to just mention because it was brought up earlier, that was some very positive news yesterday about one of the vaccines that's in trials, and I don't have additional information other than what's been reported in the news about that. But that I think it's important just to remind everyone again that this isn't going to last forever. And that very promising news yesterday about one of the vaccines, and there are many vaccines that are in trial, bodes well for the whole world, our country, our state, and this county. That in the not that distant future, we're going to be able to have vaccine that we can administer, which is going to actually provide the immunity that we're all going to need for this novel new virus, so that we can greatly diminish the incidence of disease and begin to get on top of it. So there is hope. It isn't all dismal, but we all need to do our part right now before that vaccine is available, so that we can prevent unnecessary deaths in our community. So we're asking everybody to redouble your efforts to socially distance during this time. Help us get these numbers down, limit transmission, so that we all can get immune to this disease through a vaccine and not have to suffer the disease itself.
All right, thank you, Donnell. Anything else to add? All right, we will be back next week on Wednesday at 11 a.m. Everyone stay safe and healthy, and we will see you then.